Cases of monkeypox are increasing, they're spreading. How worried should we be about this disease?
Well, on Radio National Breakfast this morning, I had Professor Michael Osterholm, who's a world authority on biosecurity and emerging viruses. And his argument is that the genie is out of the bottle, that basically this is spreading. It's going to be very hard to control, even though the numbers are relatively small, and that it is a pandemic now because it's in so many countries in the world it qualifies as a pandemic. But that luckily it's not that severe. So in other words, in Africa it's more severe. So in West Africa, where this comes from is about a 1% fatality rate. In Central Africa, a different form of the virus, 10%, but it's much less than that. So we've had at least 22,000 cases, probably more, and 3 fatalities, although it's now spreading to children. It's an uncomfortable disease, it can make you quite sick, and it's a particular risk to people who are immunocompromised. So it's not nothing, but we do have smallpox vaccines, and we do have antivirals which can help to control it.
So the WHO last week declared it a global health emergency. What's happened since then? What difference does that actually make?
Well, countries are supposed to, as members of the WHO, member countries are supposed to take note of that and respond and have their plans made accordingly. We have national guidelines now for monkeypox for GPs and others to follow. The problem is that ideally what you want to do is ring vaccinate around each contact, but we probably don't have enough vaccine for that at the moment, so it's high-risk individuals and high-risk situations. But it's the second-generation vaccine, which is a bit riskier than the third-generation vaccine, which is not yet available in Australia. And the reason it's a bit riskier is that the virus multiplies inside your body to give you the immunity. It doesn't with the third generation, so hopefully get that. And then there are the antivirals, which can be used. So we've got ways of controlling it. So we're not in a situation that we were in with COVID-19 or indeed HIV at the beginning.
On the show this afternoon on RN, on the Health Report, you have a story about vitamin D. What's that?
Yes, a huge trial of 26,000 people, randomised controlled trial of vitamin D, has put in probably its final results and has shown that vitamin D supplementation, regardless of your level of vitamin D, in other words, well people, is of no value. It doesn't prevent heart disease, it doesn't prevent cancer, and it doesn't prevent fractured bones. And it's irrespective of your level of vitamin D. So even people with low vitamin D levels did not benefit from vitamin D supplementation. So there's still a small group of people who do, particularly women with dark skin who are not getting exposed to the sun. Sudanese community in Melbourne is an example where their kids can grow up without enough, can be developed without enough vitamin D. They need supplementation. And there are medical conditions where you need vitamin D supplementation. But for the average person, regardless of age and your level of vitamin D, save you money.
Let's turn to COVID now, inevitably. Where are we in terms of case numbers and death numbers, and where are we in this latest
Well, death
wave?
Numbers are uncomfortably high. So a month ago when we were talking about it, there were 30, 40, 50 a day. It's getting higher than that. There are some signs that maybe we've reached a peak, but other people are arguing that the peak is yet to come. And certainly the worst surge of COVID that we've had. The hospitalization to infection ratio is a bit higher, so people, particularly who are under-vaccinated or unvaccinated, can really get quite sick with this virus. But the number of people flowing through to ICU is lower. So the vaccines are working in a lot of people, but in some people they're getting breakthrough into needing to go into hospital, whereas if they'd had the third dose, much less the fourth dose, they've probably been protected.
Good to see you, Norman. Thank you. More on the Health Report at 5:30 on RN today. Thanks.
Thanks.